Ingrown toenails. Just the name can make you cringe. They are a common, painful condition that can affect anyone. Ingrown toenails occur when your toenail grows into the surrounding skin. This can cause discomfort, redness, and even infection. While anyone can get an ingrown toenail, some people are more susceptible than others. Understanding the causes, symptoms, and treatment options can help you find relief and prevent future problems. Imagine your toenail as a train and the skin around it as the track. An ingrown toenail is like the train going off the rails, digging into the surrounding ground. Instead of growing straight out, the edge or corner of your toenail curves and grows into the soft flesh of your toe. This usually happens on the big toe, but other toes can be affected too. The pressure from the nail irritates the skin, causing pain, redness, and swelling. So, why do ingrown toenails happen? There are several reasons, and understanding them can help you prevent this painful condition. One of the most common culprits is improper nail trimming. When you cut your toenails the wrong way, you set the stage for trouble. Cutting your toenails too short or rounding the edges can encourage the nail to grow into the skin. This seemingly small mistake can lead to significant discomfort. Wearing tight shoes or socks that crowd your toes can also contribute to the problem. The pressure from tight footwear can push the nail into the skin, causing it to become ingrown. Toe injuries, like stubbing your toe or dropping something heavy on it, can also increase your risk. Even a minor injury can change the way your nail grows. And sometimes, genetics play a role, with some people being simply more prone to ingrown toenails due to the shape of their nails or toes. If your parents had them, you might be more likely to get them too. Understanding these factors can help you take steps to avoid ingrown toenails in the future. Section 4. Recognizing the symptoms. How do you know if you have an ingrown toenail? Look out for these telltale signs. Pain and tenderness along the edge of your toe, especially when pressure is applied, are early indicators. The area might also be red, swollen, and warm to the touch. In some cases, you might see pus or a clear fluid draining from the site, which could indicate an infection. If you notice any of these symptoms, it's important to address them promptly to prevent further complications. Section 5. Diagnosis and when to see a doctor. Diagnosing an ingrown toenail is usually straightforward. It often starts with a simple visual examination. A healthcare professional will closely inspect your toe, looking for telltale signs. They'll look for the characteristic signs of inflammation, such as redness, swelling, and tenderness around the nail. If there's any discharge or pus, they might take a sample to test for infection, ensuring you get the right treatment. While home remedies, like soaking the foot in warm water or using over-the-counter ointments, can be helpful for mild cases, it's crucial to see a doctor if the pain becomes severe. You notice signs of infection, such as increased redness, warmth, or discharge, or if the ingrown toenail doesn't improve with home care after a few days. People with diabetes, peripheral artery disease, or other conditions that affect circulation should seek medical attention sooner rather than later to prevent complications. Early intervention can prevent more serious issues, such as infections spreading to the bone or chronic pain. Section 6. Home remedies. Relief at your feet. For mild cases of ingrown toenails, there are several things you can do at home to find relief. Soaking your foot in warm water with Epsom salt can help soften the skin and reduce inflammation. Gently massaging the area can help drain any fluid buildup. Over-the-counter pain relievers like ibuprofen or acetaminophen can help manage discomfort. However, it's important to avoid trying to dig out the ingrown nail yourself, as this can worsen the condition and increase the risk of infection. Section 7. Prevention. Keeping your toes happy. Prevention is always better than cure, and there are several steps you can take to keep ingrown toenails at bay. By following these simple yet effective tips, you can ensure that your feet remain healthy and pain-free. First and foremost, practice good foot hygiene. This is the foundation of healthy feet and can prevent a multitude of problems. Wash your feet daily with soap and water and dry them thoroughly, especially between the toes. Moisture left between the toes can lead to fungal infections, which can complicate foot health. When trimming your toenails, cut them straight across, leaving a small amount of white at the edge. This helps prevent the nails from growing into the skin, which can cause painful ingrown toenails. Avoid wearing tight shoes or socks that squeeze your toes together. Opt for comfortable, well-fitting footwear that allows your toes to move freely and breathe. If you've had ingrown toenails before, be extra vigilant about these preventive measures to minimize the risk of recurrence. Regularly inspect your feet and toenails for any signs of trouble. Remember, happy toes make for a happy you. Taking a few minutes each day to care for your feet can make a world of difference in your overall well-being. So, keep those toes happy and enjoy the comfort and health that comes with it.